Hi, this is Hannah, one of the OTs from Best Start Clinic, and welcome to the first video in my toilet training series. How do I know my child is ready for toilet training? So this might be a question that's running in your mind, especially if this is your first time in toilet training a child. And a question you might ask is, what age should I start toilet training my child? And this is a common question that families often ask, and there really is a range of ages depending on both the readiness of both the child and the family. So some signs that children are ready for toilet training can occur from 2 years onwards. However, for some children this might start to occur slightly earlier, and for some children this might start to occur slightly later. And the important thing to remember is that there's nothing wrong with that and that every child and family is different. So what are some signs that my child might be ready? So some signs that your child might be ready to start toilet training include: 1, physically being ready. So are they able to walk and sit upright for short periods of time? Because that's what they're going to have to do when they get up and sit on the toilet. Number 2, are they starting to show some signs of independence? So this includes being able to pull their pants up and down, being able to get up onto the toilet, using a step stool or a children's toilet frame, and are they able to follow simple instructions? Number 3 is, are they starting to show signs of awareness that they've done something in their nappy? So that are they able to indicate to you using words or gestures that they've done a wee or a poo? And even more so, if they're able to indicate that to you before they've done it, then they're starting to really get ready for toilet training. So some cues that your child might be showing signs of awareness include wiggling around in a certain way that correlates with when they usually soil or wet their nappy, hiding in the corner to do a wee or a poo in their nappy, pointing to their crotch or nappy, becoming interested in others going to the toilet, and having an increasingly dry nappy. So this could be from when waking up from a nap or having a nappy dry for longer than usual. Number 4 is, does your child have regular bowel movements, and do they have dry nappies for up to 1 to 2 hours, indicating that they've got some form of bladder control? And number 5, do they start to dislike wearing a nappy and start to try taking it off when they've done something in it? So these are all signs that can help determine a pattern if your child might be ready for toilet training. Not all of these signs need to be present at once, but they can help indicate whether your child might be ready to start the toilet training process or not. And if your child's not ready, if they're not interested or they're becoming resistant to toilet training, then it's perfectly fine to take a pause and try again at a later date, because the important thing is to start when your child is ready, when the family is ready, and to also keep it a positive experience for them as well. So if your child has special needs, they may show the same signs of readiness, but they might appear when your child is older, or the toilet training process might take slightly longer, and they may need help in becoming ready as well. So your child might also need special adaptations put in place by an OT, and also help in acquiring the skills they need for toilet training, as well as have equipment ready that will assist them to be ready to toilet train. But OTs can definitely help with that. So I hope you found this first video in the toilet training series useful, and stay tuned for my next video, how to know if you're ready as a parent and what equipment to have set up and prepared.